have your slides ready or however you want to, present, I'll call your name. You can feel free to be on mute and be off camera when you're not presenting. But when I call you, come off mute, start your camera, share your screen. I will set a timer. In fact, I can probably do it here on Zoom so you can see what the time is. I'm going to be fairly strict. I'll, not let you go more than a few seconds over time. I may have to cut you off here, but then we are all going, the judges are going to be voting while you're pitching. We'll have 2 to 3 minutes of just feedback. So we're not going to do Q&A, but we're just going to give you pointers because this is all also prep for, for the main stage. So we'll give you some pointers. So, take some notes when we give you the feedback. Then when we get through, we get to the end, we'll deliberate for a few minutes. We'll just select the 4 companies that are going to make it on to the next round and, let you all go to have some dinner. Right on. Do rock and roll?
Let's do it.
Okay. First off, we have Clean Ride, Simeon Ononobi. Are you there? There you are.
Yeah, I am. Good evening, everyone. When does my time start?
You're first. Take a moment. So yeah, you can share your screen, get your slides up. You're a little muffled. I don't know if you can.
Audio is a little.
I don't know if you can clear up your microphone a little bit, just so we can hear you a little more clearly. Okay. Do you all see that little timer over there? Okay. So there's your time.
What about now?
It's a little bit better, but
yeah, it's not great. I mean, I can hear you. It's just I may just have to. I'll just turn up the sound and listen closely. Now I don't hear you at all. Simeon, if you need a little bit more time, we could skip to the next one and come back in 10 minutes.
Yeah, let's do that.
All right, let's go ahead. All right, we're gonna bump you, Simeon, and let's move on to Get Bob. Mikhail Lemberg.
That is me.
Okay.
I think you need to remove the screen share first.
Yep.
There we go.
There you go.
All right. Hang on as I get this started. Hopefully I'll have a little more luck. All right.
Since we all live in a virtual world, right? This is the Shure, I think it's called the MV7. It's a couple $100, but it sounds good, right?
It does.
I bought this thing at the beginning of the pandemic because I knew that we were going to be stuck on Zoom for our entire lives. Invest in a good microphone. Camera doesn't matter as much, but a good microphone this day and age, I think is worth it.
I concur.
There you go.
I gotta get myself one of those.
There you go.
All right, I am ready.
Okay.
Go for it, but
3, 2, 1, go for it.
Hey everybody, my name is Michael and I am here to introduce you to Bob, your new business operator buddy. We live in interesting times, to say the least. It's easier than ever to create a product, but it's getting more and more complicated to run a business every day. Small and medium businesses especially drown in apps, data silos, and rampant SaaS costs. They're looking for a solution that actually relieves them of work, but they haven't found it yet. What if you had one place where you could automate any job across any team or function just by describing the job? With GetBob, our customers reduce the amount of time they spend performing manual tasks, they become more productive as a business, and they can cut the cost of unused SaaS licenses. GetBob lets you create autonomous business operator buddies, or Bobs as we call them, to help you automate your business. Each Bob behaves just like a real person. You tell it about the job or say what you need help with, and it will instantly automate everything for you. It's not just a workflow builder. It's a true work automation platform, and it's completely no code. Now, if you've ever tried an AI employee before, you probably found that while it might provide helpful advice, it really doesn't relieve you of any actual work. You still have to do everything yourself. GetBob is entirely different. When you give your Bob a job description, it instantly takes ownership of the entire job, It doesn't just automate a workflow, it continuously identifies and executes every deliverable that is expected of the given job. Our model-agnostic orchestration technology, which is proprietary, is how we have managed to combine the best of two worlds: AI-level intelligence and human-level autonomy. Gergo and I founded GetBob together after having worked together for over 9 years, scaling the product and business of Brandwatch from its early infancy to thousands of customers and over 200 million ARR. We created GetBob because we had both seen and felt the frustration and fatigue that tool overload and context switching causes for regular business operators, and we're obsessed with solving this problem. The global market for agentic AI is growing almost 50% per year. Over the next years, hundreds of billions of dollars will be dedicated to AI employees and work automation. We believe the winner of this race will be the solution that best captures the large segment of business operators who don't enjoy spending hours at YouTube University trying to learn agentic AI. Our business model is B2B SaaS, with entry-level pricing starting at just $29 a month. Our pricing plans are outcome-driven and scales with the value we deliver to our customers. We began testing our product in private beta late last year, and we announced our public availability earlier this month. We're on a path to create at least $200,000 in revenue and 900,000 ARR this year, setting us up for our 2030 target of 100 million ARR. Our unfair advantage is that we have our own product. We've created a fully autonomous go-to-market machine consisting of Bobs that research, write, and publish content, drive social engagement, nurture leads, and identify trends and new content opportunities. It's actually not just an effective strategy for us, it's also a great case study for our product. Our early traction indicators are very encouraging. We are seeing strong engagement rates on our outbound email campaigns. Our formula is highly scalable and lets us sidestep traditional and expensive distributions like paid ads. And what's even more exciting is that over 70% of our free trials so far have converted to happy paying customers. They love the work that their Bobs do for them, and we're happy to share our case studies. We are raising $900,000 pre-seed at a 9.5 million post-money value cap to create 18 months of runway. Our goal is to go from early traction to true scale by amplifying our tested and validated go-to-market model. Thank you.
My goodness, Eric, you got to even walk off the stage music.
That's hilarious. We got stage music here. That's nice.
Wow, that's pretty good.
We're ramping it up here. Thank you, Zoom, for that. All right. Well, perfect timing. All right. So I guess you're going to get the music at 5 minutes. Maybe I'll bump it up to give everyone an extra 10 seconds, just not to be a jerk. But all right. Awesome. Thank you for that presentation. So we have a couple minutes for feedback.
Yep.
Misty, would you like to go first? Put your hand up.
Yeah, thanks so much, Eric. Michael, great presentation. Thank you so much for sharing. The first thing that I really wanted to hit on is your team. Your team, I mean, you said that you have multiple M&A experience and exits, and there seemed to be a lot, like as you were talking, I was reading all that detail. I would lead with that. A lot of what you were sharing with us was very broad and very vague. Most of my questions are like, what's that one problem? What does productivity mean in terms of what you can solve? Which manual task? Why should I trust Bob? The thing that really captured my attention as an investor is your background. And it seemed like that was the one thing that you kind of glossed over, like, I mean, it's probably a humility thing. You're very humble. But I would definitely hit that. And then in terms of your particular solution, there are tons of agentic solutions right now that are automating tasks. I wasn't clear on why I should trust Bob specifically, and I would absolutely love to understand what's going to make you a market leader. And then my last point, because I won't read you everything that I have, but my last point is you also put in your fundraising, you were raising 900K, but it was more for running your business, which would be amazing as an investor, getting 900K from someone and being like, look, we now have payroll and we now have operations expenses taken care of. But as an investor, I want to know that my money is making me money. So selfishly, instead of just seeing that, yay, I gave you money and you used it to run your business, what are you going to do to turn each of those dollars that you're given into more dollars? Like, how are you going to 2x that 900K is what I would love for you to focus on in the next pitch. This 900K turns into 1.8 million this way. And I know I said this was the last one, but one more, because I think this is really important. You used a very specific term. You said on a path to 200K in revenue, but that wasn't very clear. It sounded like very coded speak, or maybe loophole speak for, we have some interest, but not a lot of traction. So how can I say this in a way to not really make that apparent? And I would much prefer for you to say, we right now have 3 paying customers or 10 paying customers paying us this amount. I know you mentioned that you have in the past 2 weeks. I think it was approximately 10K MRR, but like really specify your traction. And then how do you get to 200K in revenue, 900K in ARR in the next 12 months? Like really walking me through that so I feel confident.
Awesome. Good feedback. Paymon, you got any?
Sure, let me go next. So, good job, Michael. Interesting version of the pitch deck. I've seen different versions of this. So, one of the things I know is, in the past, I really struggled to talk about the product, getting people to really understand it. So, the way you pitched it this time is a lot better. But I agree with Misty. Your differentiation of what's different between this and all the other agentic companies out there is still missing a little. Time-wise, though, I found it interesting that you spent almost 3 minutes until you got up to your market opportunity slide. So I was wondering, he's not going to get done in time, but you were able to still finish it. So, well, part of it was exactly what Misty pointed out on your an airplane go by on your financial projection slide. You really glossed over that slide. Like, how does the 200K happen? What's the what's driving it? And then also you go from 200 to a pretty large number the next year. What are you doing to, increase the confidence level of this is what's happening and this is how we're going to drive this revenue going into next year. So spend a little bit more time emphasizing this. I know we've had the challenge of let me make sure people really understand what we're building. But spending 5 minutes goes by fast, as you can tell. So there are some very key elements on the business side of your pitch that you want to make sure you really cover. I mean, like the financial forecast is really one, and then also the on the ask itself. You're asking for almost $1 million. The use of funds, although the diagram is there, but talking to them and say we're going to take this money. These are the achievements we want to be able to gain with the utilization of the money. But overall, good job. Let's get Bob.
Thanks.
So my only feedback, and I'm going to be a broken record. You're going to hear me talk about this all night, especially in the early stages. It's all about validation. So there's all of these projections and there's all these claims, but I didn't see something really specific that was like, here was a customer use case. This is how it worked. This is what we did. This is how we saved the money. And this is what they're saying that why they love what we're doing. In fact, it came up in the slide. I saw a URL. So I went to your website and started looking through your use cases because that was actually what I was looking for. That was really interesting for me, is like real customers, real use cases, real impact, because especially when you're on the small scale, we have to know that this thing works kind of in the lab. Then we can all assume like, all right, we can figure out a way to scale this up. And of course, there's gotchas in a lot of different industries, but like, if you can't prove that it works really well on a small scale, then then we have no idea whether it's going to work on a large scale. So, okay, we got to move on. Thank you, Mikhail. If everyone has their votes in, we will hand it back over to Simeon. Simeon, you ready?
Eric, just one point. I think Lakeisha joined.
Oh, great.
Lakeisha, you here?
She did join, yes.
Hello.
Hi, everyone.
Welcome.
Hi. Thanks.
Our final judge is here. We'll give you a pass on this first one, but are you ready to jump in and vote Neelam, and go
Ready,
to the next one.
ready to do it. Yes.
Ready to rock. Okay, awesome. Simeon, you there? Okay, you good?
Yes.
Awesome. All right, take a deep breath. 3, 2, 1, go for it.
Yeah. Thank you very much. My name is Simeon Anunobi. I'm the founder at CleanRide, the operating system for full service car washes. Basically, I'm going to be presenting to you today so a software solution that is solving a still online service category that is huge, and that's the auto industry. Now, what's the problem? The problem is everybody on this panel has a car. You have one car, two cars in the family, and you also have busy times. You can't go to the car wash and sit around for 45 to 2 hours waiting for your car to be washed. Now, the problem is it's a two-sided face because the operator also has that challenge. The operator can staff correctly. They don't know when Eric is going to come to the car wash. They don't know when Latisha or when Payman is going to come to the car wash. So they don't know how many staffers are supposed to be on deck. So they lose a lot of money based off this. Now, this is a problem that I face personally because I bought a car wash late to 2024, and I saw this problem firsthand, where the company was making about $300,000. And I just had to figure out a way to solve this problem. And solving it for myself, last year we did 780,000. That's a 160,000 jump from what we did initially. And that gave me this eureka moment. I could solve this problem for the industry. And that is where the solution was birthed. A solution where we have a booking service that allows customers to be able to conveniently book a car wash service, just like you book a restaurant or you book a haircut. You can book that today. Now we also have a provisional patent that is that has been provided, and we're going for a TT patent where we could create a solution that allows the customer to book a car wash. But on the operator side, it allows the operator to stop the guesswork, because today operators will think, hey, is the cloud going to come out? Let me check the weather before I know how to staff. And that creates a lot of confusion in this space. So you have 8 people servicing 100 cars, and that creates a lot of imbalance and a lot of lost revenue. Now that comes in CleanRide. CleanRide is a solution that helps reservation and operation platform that helps customers to save time and enjoy a better car wash experience. But on the operator side, it increases revenue, predicts demand, and also runs efficiently. The car wash industry is huge. Everybody knows that. A year alone, we do about $18 billion. And what we're actually going for is about the $500 million, where we'd have only 5,000 locations using our service. The business model is straightforward. What we've done to ourselves is to say, car wash owners, just pay a SaaS fee of $299 a month, and you get all this bells and whistles. But if you do get up to 200 car wash customers booking through your platform, you get a free service, but you take a 5% uptake on all transactions. And that is how we've actually been able to grow. This year, we're definitely going to be targeting the 760,000. Currently, we've only 6 locations today, and we're already at a $80,000 ARR. In 2030, we're projecting that we're going to do 45 million, and it is straightforward. The car wash numbers, the number of bookings, and the take that we take automatically calculates how much we make from this service. Now, and go-to-market is what we're using today. We have started talking to car wash owners. We're going to shows, and we're talking to them, and we're using LinkedIn to provide them this service where they can test the service and they can do. Now they bring up upon the customers onto the platform, and the customers can use this service. If you see the platform, it's simple to use, and it actually creates a flywheel. We do have competition. Google Maps is our biggest competitor here because that's where you find car washes, but they don't allow for reservations, full service, focusing, and operator tools are not on Google Maps. We also have Spiffy and the likes of them, but they're mobile detecting services who come to your house to provide the service. I'm a 3-time founder. I've done this before. I've exited a startup in the past, and I've also been part of different companies. I have Andrew Dell as my advisor, and also Madonna, who also have expertise in banking and also operating real sector services. Our metric, like I said before I did this product, before I did this speech, it was almost like 2 weeks ago. Currently, we're at about 80,000 ARR, just 6 partner locations right now using the platform, and we are also registering customers every day. We also have on our pipeline, if you go to our website, we have a 78 car wash pipeline that are already started registering on the platform. Our ask is straightforward. We're asking for 750K for that 6 million to be able to push to that 1 million ARR. We're making money today, and we don't think that we're going to be out of money anytime soon. I'm happy to take your questions. This is an industry that I'm very passionate about because I have lived it, I've seen the problems, and I'm solving the problems on a daily basis. There are over 250 million cars on the roads daily, and we believe that these cars, whether automation comes or not, they're going to be washed, they're going to be serviced, and we are in this service to win. And like I said, we're the only ones in the space doing this, what we're doing, and that's why we're going to get a patent, and we will hope to make this a solid product for the future. Thank you very much.
That's funny.
Perfect timing. Look at
My goodness.
that. All right. Thank you, Simeon. I appreciate that. All right. Who would like to give some feedback first?
I'll go last on this one.
Okay. Misty, Lakeisha?
Yeah, I'm happy to go. I know I went first last time, so I was just trying to give someone else the opportunity. Simeon, thank you so much for this pitch, and also congratulations on your progress in building not only your car wash side, but I can definitely see the passion for this. The one thing that I would ask, and that maybe this is just for me, especially being an American, is just to maybe practice slowing down and enunciating a little bit when you're giving your pitch, only because there's so much good detail, but I missed some of the information because you were speeding through, and I know you know it, but just making sure that you're articulating for us. The few questions that I had is in regards to your go-to-market and business development plans. They were on the vague side, so I would love to see that enhanced for your pitch. Are you utilizing your current car washes? Is it in a very specific area that you're starting, and then how do you expand? I already see this as a good business. There's no question in my mind that you can make this a good business. So right away, you get the check mark of like, if you just wanted to go and live your life, King, you could totally do that. What I don't know is, how is this venture backable? Your margins are razor thin. And so what makes this a venture backable play? And similar to the feedback that I gave before, how do you turn this from a good business into a scalable return on investment for someone who's providing you with those investment dollars?
Yeah, that's great, Misty. And just to build on that, first of all, Simeon, great presentation. I think that my sort of main feedback was, I see that there's a large TAM, and I see where you are, and I want to see what is the path to really capturing that TAM, right? What is your sort of go to market so that you can scale to capture as much of that TAM as possible? And so you just want to take us as quickly as you can to understand, oh, this is how this is going to be venture backable, i.e. your ability to capture this large TAM that you described to us. So you did a great job getting everyone really excited about this market size, but then I sort of walked away thinking, but how do we capture that, right? And how does this thing scale? But I think you did a really fantastic job bringing up, making the case for the need of what you do, why you're the person to do it, and really indicating that you sort of lived that pain point and you've built a solution for it. So I'll pause there and pass it to another judge.
Yeah, good job, Simeon. I think, one of the things that jumped out at me that from the positive side is that you own a car wash. So that was the first thing. Say, okay, this guy knows what he's talking about. He's eating his own dog food. He's living and breathing this problem. And so, that was the first step. And then the fact that you're a 3-time founder with a successful exit. So, it's not every case where it makes sense to kind of use that as part of the introduction, but in a space like this where, I don't personally understand the market super well, I would, as an investor, it's good to know, okay, this is somebody who not only is actively a business owner in this industry, but also is a serial entrepreneur and has successful exits in the past. Okay, now I'm listening. Then from there, again, back to the validation piece. So, small amount of revenue. So it should be really easy for you to get some really great data and testimonials from the few customers that you have telling you how they're raving fans. And then from there, we can extrapolate to say, all right, if you know this space, if you got connections in the space and you've built a product that a handful of customers really, really love, then I see where this is going.
Very good. Let me jump in. Good job, Simeon. I think the biggest thing for me was your pacing. Kind of also, I think Misty touched on that too. So you spent about a minute talking about the problem.
I'm Nigerian.
Yeah, and then the rest it was right. I mean, so part of what you do we all have cars. We all, we all go to car washes. So the pain is real. We all know we had to sit there. So I don't know if you need to spend that much time. Also, keep in mind that the amount of text you have on these slides, and then when you start really going through the rest of them, the pace that you have is tough to see everything that's on the slide. So you got to really practice your pacing to make sure that your audience can keep up with you, And then also, I misheard you. It sounded like on your financial forecast slide, you said you have 80K of revenue, but the traction says 6K. Maybe I just misheard you. But
At the time I did the pitch, we were 2 weeks ago. Right now, we're on track to do 80K ARR.
So you want to make sure the slides are up to date, so it matches what you're saying.
Yeah.
Right, because that's an inconsistency. I mean, I look at numbers all the time trying to understand exactly where you're at, and then anything else? No, I think that's the big thing. But overall, I mean, like, everybody said, this is a great business, and you're definitely the right person to go build this. And I'm still shocked this doesn't exist yet. So it's like, everybody reserves appointments to do everything. How come there's not one for car washes? So, this should be very great. So anyway, good job.
Thank you.
All right, awesome. Let's move on to MetaNeural. Claudio, you there?
Yep. Can everyone hear me? Everyone? Okay, the microphone works. Perfect.
Sound great. All right, you got your slides?
Yes, let me share the screen first. I just want to see you guys too. You look very funky. Thank you, Ron. So, can I start the presentation?
Yep, go ahead. 3, 2,
Okay.
1.
Okay, good. So, hello everyone, and thank you for the opportunity to present today. I'm Claudio, CEO of MetaNeural. Would any of us here today even consider boarding an airplane, knowing that the pilots have never been trained on a flight simulator? Aviation didn't become safe because pilots got smarter. It became safe because simulation became infrastructure. Sadly, the majority of hazardous industries never made that shift. Critical failures are still trained in real environments. That's not a safety gap. It's an infrastructure gap. At MetaNeural, we're building the AI-powered simulation operating system that finally makes industrial training scalable. Today, high-risk industries rely on training methods that cannot keep up. Industrial XR simulations are effective, but they are slow and expensive to build because they require knowledge transfer from internal experts to developers. Visual logic tools still require programming mindsets, while complex physics and heavy CAD models break most systems. Furthermore, companies are becoming more and more reluctant to share their sensitive CAD and operational data externally. So training stays oversimplified, hard and expensive to update, therefore impossible to scale. Before MetaNeural, for almost 9 years, we've built bespoke MVR training for oil and gas, manufacturing, and aerospace. The pattern was always the same: custom code with little to no reusability, high cost, and long timelines. MetaNeural replaces that with a fully scalable simulation platform, a true operating system built to support complex CAD and operational constraints. Safety experts described procedures in plain natural language with no need to code. Our GenAI converts that into full simulation logic. XR becomes the interface delivering the best proven learning outcomes. Experts can go from description to deployable training modules in days, not months. This is a huge market size opportunity because XR training is a fast-growing market. We start focus on oil and gas and clean rooms, and then because this is where the urgency lies, and then we expand because we can actually touch any kind of high-risk industries, but it's important to have this focus. MetaNeural is already converting enterprise demand into revenue. We have to date $104,000 in revenue with the product in the market. We're running 7 active pilots across oil and gas, semiconductors, and maritime, including 2 Fortune 500 companies. 2 pilots are already converting into paid subscriptions. And behind this sits a $1.2 million qualified pipeline. This validates enterprise readiness at scale. We run a SaaS plus usage model where customers pay annual licenses when they consume credits and they build and run training scenarios. We offer starter, pro, and enterprise tiers with a cloud or premium on-prem deployment. So revenue naturally scales as usage grows. We are 2 deeply technical founders with complementary strengths, and been with high school colleagues and lifelong friends. I bring over 10 years in external simulation with more than 50 industrial projects delivered to date. Stefan, my co-founder, brings 15 years in enterprise systems, secure data ingestions, AI orchestration, and scalable architectures. We've executed together successfully for over 5 years and are backed by industry veterans in semiconductors, oil and gas, and manufacturing. Every hazardous industry will eventually train like aviation. Simulation becomes mandatory infrastructure. Companies that adopt it early gain safety and operational advantage. We're building the platform that powers that shift. We're raising $1 million in pre-seed funding. This capital converts pilots into long-term contracts, builds enterprise sales capacity, and scales our AI infrastructure. We've proven customers will pay. We've proven that we can sell to demanding enterprises, but this is bigger than revenue. No one should experience critical failures in the real world. If aviation made simulation standard, hazardous industries can too. That's the future we're building, and now we're ready to scale. Thank you very much. I'm happy to take any questions.
All right, a minute to spare.
I think I could include one more slide. So
slow down a little bit,
yes, and slow down.
Well, I guess I might as well go first. Great presentation, crisp, clear, beautiful slides. The delivery was definitely on point. Again, a little fast, but very well done there for sure. Obviously, an innovative space. I'm curious about what the kind of differentiation is here. I mean, obviously, you're sort of specializing in the niche or this area of oil and gas. And I'm unclear what other solutions are out there that maybe aren't VR related. Like, are there other kinds of simulations? I remember seeing something on Wired a while back about these big giant rooms with like projection screens that they used for some of this kind of stuff. But anyway, just some understanding of what other solutions are out there would have been valuable. One thing I didn't quite get on the team, you obviously have a lot of experience, but has anyone been founders before? You've got this broad advisory board, but do they come from name brand kinds of companies? So again, there seems to be a lot of experience, but maybe a name or two that we would recognize might be valuable. Obviously, the proof is in the pudding, so the traction and the revenue is definitely there, but still, okay, you've got some oil and gas customers. How do you know that they're really satisfied with the product? Are they telling you? Is there retention? Are they upselling? That kind of thing. And so, as always, a little more validation would be good. But overall, very good presentation.
Thank you.
Wonderful. Go ahead, Lakeisha.
Yeah, I suppose I could go next. Thanks, Misty. Really, really fantastic presentation. The visuals were great. Your pacing, even though it was a little bit fast, I can now go tell someone what you're building and why you're building it. And so really well done on the presentation. I think I walked away, but my main question that I walked away with is, okay, if there's an opportunity to truly scale this business, we've got to be able to get away from oil and gas. And what isn't clear, and I'm not sure how you would do this, but you had like a minute left. And I think what an investor wants to understand is, do you have proprietary knowledge that allows you to understand how to simulate? Do you get this from the industry? Where does the intel come from such that the types of simulations that are needed for each industry, right? So can you easily go into an entirely new industry and prepare all of the sort of simulations needed? Do you need a partner to do that? And so that was what I would say my main kind of gap in understanding that would have been helpful. But I really thought you did a fantastic job, and it was a really it also felt a bit novel. And I also, Eric, what you said, you mentioned you could have potentially had one more slide. I would have loved to just see a competitor landscape, because you would think, okay, the currently simulation already happens. Who's doing it? We already know that it is happening, but you're essentially saying, I don't know if your differentiation is, but hey, we're doing this with oil and gas and it doesn't exist here. Or, so I think you talking a bit about that differentiation piece would have been really helpful. But otherwise, really, really great presentation.
Thank you. Great feedback. Thank you.
Misty, you want to go or you want me to go?
I'll go and I'll let you take us home. How's that?
Sure, go for it.
I concur with everyone else who's given you feedback. Very solid presentation. Your UX UI is absolute fire. So amazing job there. And then in terms of your validation and traction, for me, it was extremely clear. And I love that your business model was solid, perhaps showing a little bit more detail on, even though you're SaaS licensing, how much per license, and then how long does that last? Is that renewed every year? So maybe just a tad bit more detail there. I would also like a little bit more on the technology, because you are doing training. How do you do the training? And then what happens if this succeeds? And what happens if customers don't use this? So really drive home, this is how it fails. And this is what happens if this technology isn't used. And maybe that is they're going with status quo. You gave an extremely relevant example in the beginning. Airline pilots utilizing simulations that allow them to fly the planes better. Great. I would love to see that same level of specificity when you're talking about your customers. I'm assuming oil and gas is your beachhead. And then where do you expand from there? Like a really clear product roadmap of, we're starting with oil and gas because here's the reason why. We know this industry. We come from that. What are the reasons? I'm making them up now. And then we are going to move into this industry because, or like, what is the vision for this? And then what else needs to exist, especially if you're doing VR. That's an actual physical headset. I am not assuming that that's part of what you're building, meaning the hardware. You're building the software side. So what happens as there's a large component of your business that's outside of your control. So like, how do you make sure that those two things are working synergistically when you have like the core delivery system for your technology is completely outside of your control? So I'd love to understand that a little as well. And then this just goes for everybody. Just be very wary of the words that you use. Maybe instead of saying like, we have product market fit or we have proven XYZ, there's signals at this point. 3 paying customers, you have a signal that people want this. For me, proven is you're getting more inbound than you can keep up with, and that's why you need the investment. Now I'm like, oh, you've proven something. Right now I see a nice signal. Again, solid business, solid pitch, great presentation. I think that we can have just a little bit more meat in order to help us feel confident in the fact that you can become a market leader.
Perfect. Thank you.
Absolutely.
All right. Let me share a little bit different perspective. So for me, your slides were distracting. So the way you had them, and they were beautiful, beautiful slides, but for me, what I found myself doing, I was anticipating what's going to happen next, what's moving around, and I found myself, I'm not listening to you. And then some of your text that you have on your slide, they're very marketing oriented, right? And then you had a lot of words to go around them. You had like 2-3 words on the slide. And then there's a lot of verbal communication over the slide. So then connecting the two, trying to follow you. I mean, generally it worked. You did a great job in terms of presenting it. I'm just saying that sometimes you got to balance the two out. I honestly ended up finding myself like looking at the graphics more than I was paying attention to what you were trying to say. So that, I mean, it's different for everyone, but that was my experience. The other thing is the business side of what you're doing. I don't think you really communicated that well. I mean, Misty touched on it too. Like your business model had nothing about their pricing. How are you charging? How does this dovetail into a financial forecast? The hardware software side of thing as well. You're building one side of this. What's the implication in the ecosystem? If things change, what are the implications to your business? I see great potential. I've seen other companies in this space, especially on the construction side, that are building same type of XR simulations to help construction workers. So it's definitely, from a training standpoint, it's a growing market. It's definitely needed. So overall, good job. Also keep in mind the color choices. You're red on black. When the fonts get small, sometimes it's hard to read. And then sometimes people have color blindness issues and things like that. Really make sure you have high contrast in some of your fonts. Your team slide also, it was really tough to figure out who's what, where's the experience coming and all that. I mean, you had an extra minute. There was a whole bunch of stuff I think you could have told us that really increases the value prop of what you're bringing forth. But overall, good job, man. I'm sure your product's got to look really, really nice given how the slides look. So that's pretty cool. Good job. This is one of the most innovating pitches I've seen. So I'll give you that.
Thank you.
All right, Claudia. Good work, man.
Great job. Okay, let's move on to Circucare. Sai, Zhu, you there?
Yes, can you hear me?
Yes. All right, are you ready?
Give me 1 second. Let me. Can you see my slides, by the way?
Yeah, it's not presentation mode, but yeah. Okay, there we go.
Oh, right. How about right now?
Yep, perfect.
Sounds good. I can start right now.
All right, ready when you are. Go for it.
Yep. Hi, everyone. Saijo from here, founder and CEO of Circucare. We are automating cardiac imaging with an AI-powered wearable ultrasound device. Cardiovascular disease is the leading cause of death, and echocardiography is the gold standard for non-invasive cardiac imaging. But today, echo is still delivered as an intermediate, technician-dependent test. So a patient with a chest pain may wait months for an answer. And that gap can be dangerous because current devices only capture isolated snapshots and depends on a highly trained technician to manually operate the probe. Critical changes may be missed between scans, which may lead to a major cardiac events. So there's an urgent need for a new echo solution. And that's why we come in with Synova, the first of its kind AI-powered wearable robotic ultrasound scanner. We have developed a miniaturized robotic system to replace the technician's hands to control the ultrasound sensor movement. By combining AI-powered image acquisition with a wearable form factor, a nurse can perform the continuous echo using Synova in seconds, as easy as taking a blood pressure. It dramatically simplifies workflow, reduces the cost per scan, and enables continuous cardiac monitoring anywhere. Our technology has already received strong recognition, including coverage by CNN and engagement from the American Society of Echocardiography, which plays a key role in defining clinical guidelines for echo worldwide. Today, we have our working prototype with a strong IP portfolio. This short video shows Synova wore under a t-shirt, operating hands-free and continuously, even doing exercise. We are also wrapping up our first in-human study at UC San Diego Health, validating image quality on 55 patients, and have confirmed the Class 2 510(k) pathway for our first product through the early interactions with the FDA. We will start with B2B for hospitals and then expand outside of hospital settings, such as rural clinics. With over 80% margin of our Synova hardware, the software subscription, as well as the comprehensive report, we are offering a scalable and recurring revenue stream. We are targeting a massive 13 billion ultrasound device market. With Synova, we can see initial market opportunity over 200 million across multiple clinical indications, with the potential to expand into a much larger market outside of hospitals over time. Here's how we look through the competition. Traditional card-based ultrasound offers high image quality, but it is expensive, slow, and highly operator dependent. Robotic arm systems, and handheld devices reduce some workflow burden, but still rely on trained technicians and only provide snapshot imaging. Other wearable approach, like for example, Sonos Microsystem, they are facing intrinsic technical limitation in cardiac imaging. Circucare is the only solution designed for continuous nurse-led cardiac imaging while maintaining clinical-grade image quality at much lower cost. Of course, we have a dream leadership team of technology inventor supported by experienced medical device veterans for go-to-market, finance, sales, and regulatory. Charles and Chris also led huge exit for their previous companies. We also have our world-class advisory board from the American Society of Echocardiography, Stanford, Johnson & Johnson, as well as GE Healthcare. Supported by top-tier partners, we are confident to deliver lasting impact for patients and providers. We are raising 1 million with only 500K remaining in this round. There are 3 key milestones will be accomplished. First, 5 foundation filings to build up our core IP portfolio, which has just been completed. Second, completing robotic system usability testing. And third, obtaining FDA pre-sub feedback. These milestones will significantly de-risk both technology and regulatory pathway, positioning the company for a clear value inflection point. At Circucare, we believe the future of ultrasound imaging will be autonomous. Synova is just the beginning. this platform technology has vast potential to be licensed out to explore different vertical markets, such as telemedicine, at-home monitoring, or even fetal health and sports medicine. Thank you for considering Circucare in your portfolio, and happy to take any question from here.
Want to go first? I can go first, if you guys want. Good job. Great presentation. And good use of videos. The way you showed exactly what's happening is really good. However, I would discourage you from using QR codes and having your website throughout the presentation. So when you're pitching to an audience like us, judges, we don't have a choice. We got to pay attention to you. Even though Eric went off on that one on somebody's website, but generally we're gonna have to pay attention. But if you're in a room pitching to a group of investors sitting in the room, and they're gonna see QR codes, they're gonna see cool stuff. Let me go jump on and you did this in less than 5 minutes. So as soon as they go onto your website, I'm sure you got pretty cool stuff on your website, given what I saw in your pitch deck. By the time they finish looking, your pitch is done. So use this slide exactly that you have it with your QR code, website, contact information, send people wherever you want here. Don't do it in the middle of the presentation. In fact, get rid of even the website address on your footers and things like that. Let them focus on exactly what you're saying. That's on the slides themselves, but the TAM that your market opportunity you talked about, the market's very clear. I mean, your delineation between TAM, SAM, all that makes all sense. Tell us a little bit more about regionality. Is this all about the US? Is this global? Is this, what are your aspirations in terms of growing the company? And also on the financial side, a little bit more there. You had more time at the end. And the last thing I would comment on is the team. So you got an amazing advisory board. You have a lot of people in this team, but you really just barely touched on, this requires, scientific background, MD background to be able to really pull this off, right? Especially the founding team. You want to be able to talk to us a little bit more about this is why this team is able to come and execute on a company like this. The emphasis you put on the advisory, that was good, but the team itself, I think the thing you had under your name was 30 under 30, things like that. Keep in mind what we're after is this the right team to be able to bring this product to market and build a $100 million company? Does this team have the right makeup to do that? So you do want to spend the time to share with that, and also what you put on the slide. But overall, good job. I like the presentation.
Thank you so much.
Thanks, Payman. Anyone else like to give some feedback?
I'll go next.
Okay.
I have 3 core things that I think could be helpful. Number one, everyone is building such incredible innovation. So when I give this feedback, please know that what you're doing is amazing. I love the fact that you care enough about this space that you want to build something to make it better. The differentiator now that we are at table stakes, there is no company that's going to come along and say, we are more expensive, we slow things down, we make things less efficient and less productive. So when you give information, whether it's about competition or whether it's about differentiation, that provides those table stakes types of details, I get the meh feeling like, well, of course it's going to be more cost effective and save time. What I would love to hear from you, and what I really want you to go deeper on, is it's like the main impetus around this technology. Why does it need to exist, and why does it need to exist right now, and who is clamoring for it? Not who can you push this on and make them buy it and beg and plead and become the Tony Robbins of motivation when it comes to buying your product, but who is like, oh my gosh, I need Circucare today. We can't XYZ, or these laws are changing, or something is shifting in the market. So we need this. Can you provide this to us? I would love for that to be the bar at which you start versus let me try and think and figure out why this is needed, other than it's a good tool. It's an innovative tool. It's helpful. I would love to see that next level of market leadership, and also just really strong attraction to what it is that you're building.
Thank you so much.
Yeah, absolutely. Great job, though.
Yeah, echoing, really great job. I think the judges have said most of it. I think the one thing that I might add is it would be really great to walk away with a clear understanding. I'd say no, but Payman, you said this, like why you're why you and your team are the ones to do this, because you mentioned Johnson & Johnson. It's hard to think that this type of thing is not already in the works, if you will, right? And because you're at the pre-seed stage, I think there's a question around, go to market, defensibility, but like we are the team to do it. We already have the inroads. And to just speak to that, because especially at this early stage, you want us to walk away and think, wow, this is innovative, which it is, and that's great. But here's why we're the team to do it, and here's what we already have in place. Because I think getting this into the market is going to be quite a challenge, of course, and that's not a problem. But it'd be helpful to hear how you think about that, right? What about you and your team makes you the team to bring this to market? That's probably my main takeaway. And I'll pass it to you, Eric.
Thank you. Yeah, that was my same point again around the team. What I do know about the healthcare space is it is a very closed industry. You've really got to know people, and even if you guys do have the most innovative solution, you might get beat out by somebody who's got better connections than you, or more experience or more money, and so. Not just that you have the best experience to build the best solution, but you have some sort of unique advantage by being able to get this thing not only through FDA approval, but into hospitals because you've got those connections. So awesome. Great job. Okay, let's move on to who's next here. We have Baritone Health. Megan Pitcher.
Hello, can you hear me?
Yep.
Fantastic. And can you see my slides?
Yes, you're good to go.
Right. Excellent. Hi, everyone. I'm Megan Pitcher, CEO and co-founder at Baritone Health. I'm going to talk to you about a problem in obstructive sleep apnea. So if you're not familiar with this disease is a disease where people suffocate during their night of sleep. So apnea events are actually suffocation events. Some people can have hundreds of events per night. These events can last up to a minute, and these periods where your body and brain are not oxygenated can lead to long-term health outcomes like increased risk of heart disease and stroke. People fall asleep while they're driving, they have accidents at work, and it is also a major quality of life issue as people are sharing beds with partners, hearing them choke and gasp and struggle to breathe all night long. The major problem we identify is in diagnostics. So the mainline diagnostics will count how many events happen. But the outcomes are that people have the same diagnosis, but very different outcomes when it comes to treatment. The reason is that each person has a different underlying cause of these obstructions in the airway. For some people, it's tongue, for others, epiglottis. And the diagnostic paradigm doesn't really identify that yet. You may be aware of a lot of activity in the home sleep testing space. Again, these are devices that are only counting apnea events, not giving underlying information about what the cause is. This means clinicians are forced to trial and error therapies, and your outcomes become unpredictable. Beyond home sleep testing and in-clinic sleep testing, there's a more advanced diagnostic where you do get a view of what's going on in the airway, but it's incredibly burdensome and invasive and happens in the operating room under sedation. The current workflow can't tell you why apnea events are happening during natural sleep, how the airway is changing across different sleep states, or if the airway is even open or closed in response to a treatment. Baritone is uniquely built to answer these questions and enable treatment matching in this field. We're building a wearable device, totally comfortable, something you can use in your own home in one night of sleep. We use passive sonar sensing to identify which collapses are relevant to apnea events happening in that patient overnight. And we empower doctors to pick the best treatment for that patient based on that information. The news at a really great price point while maintaining a really great margin, and it works as well as a surgeon. So what we envision is a way to actually match treatment to patient at the very first step of diagnosis in obstructive sleep apnea. Our value proposition, better data, better care, better economics, improving insurer efficiency, helping hospitals capture revenue that they're missing, and helping doctors increase diagnostic capacity so they can treat more patients. And of course, a much better model for the patients themselves. My background is I'm a scientist by training, a PhD from Baylor College of Medicine. I've worked in intellectual property and I've worked in biotech for many years. My chief technical officer is Eleanor Pillett. She's a Stanford-trained acoustic physicist with 70 issued patents in this sensing space. So when it comes to turning acoustics into signal, he's the guy. Britt Cross is our chief medical officer. great expertise on workflows and payments in healthcare. And we also assembled a really great advisory team with great experience in other sleep companies. I also want to highlight Bill Goss, who has really great experience on go-to-market around sleep product in particular. Where are we at right now? So I have a version of our current device. We have this in use at Houston Methodist Hospital right now. We have early clinical validation and some peer-reviewed publications, and we recently received an award from the American Academy of Sleep Medicine. We are in discussions with FDA. We've had our pre-sub, and we have applied for a breakthrough device designation. What our device produces is a video that looks like this. This is a patient from Methodist with obstructive sleep apnea, so their airway is inappropriately constricting during the sedation process. We've highlighted the four main layers of the airway that sleep surgeons are most interested in. But on the top left, you can see this airway is constricting like a purse string. That's the soft palate. So the way a doctor would use this, they would say this patient has complete concentric collapse at the soft palate. They're contraindicated for something like a hypoglossal nerve stimulator. So how we view the field, there's lots of activity on the therapeutic side. I've already told you about the patient side issues. For these therapeutic companies, they're trying to identify patients they can actually treat and have really good outcomes in. So their data can look great and they can reduce their customer acquisition costs. So really solving a two-sided problem, connecting patients to the best treatments and connecting all these treatment companies to their patient populations they can treat. We want to target the surgical planning market as our beachhead. We value that at $700 million with over 700,000 people eligible each year. I poo-pooed apnea counting, but our device also counts how many apneas occur, so we can compete in the basic home sleep testing market. When we think about our TAM, it's all these people with undiagnosed obstructive sleep apnea and snorers. We have a round open now. We have a goal of $2 million. This is to secure FDA approval with the breakthrough device. This is to convert some of our early clinical sites into pilot sales and to do some optimization on our device design. We have secured $700K already. That's already in the bank. We have terms set by our lead investor, Golden Seeds, who's an angel syndicate out of New York. We are expecting a medical device launch later into 2027 and profitability by 2028. With that, I've been Megan Pitcher at Baritone Health. We want to help you sleep like a bear without sounding like a bear. I'm happy to receive feedback from the judges. Thanks so much for the opportunity.
Thank you so much, Megan. I will kick us off. If that's okay, Eric?
Go for it.
Awesome. Sorry, the bears are just sending me. I love that. Great presentation. Thank you so much. I loved your delivery of what it is that you're building. I felt like I got a mini education in sleep apnea, which is always good. The 5 areas where I would personally love to see a little bit more detail. Number 1 is it still wasn't clear to me exactly who you're selling to. Is this a consumer play? Are you selling to actual customers? Are you selling to sleep apnea providers? Are you selling to doctors who are looking to diagnose their patients who may have sleep apnea? So getting very, very clear, less talking about it and actually really focusing in on for blank, who are blank, we're selling this thing. Like, who are you selling to and what's their problem? Why can't they solve this easily right now? The competitor slide would be great. Because I know several people, including a friend of mine who works for a sleep study clinic, several companies and organizations that do at-home sleep tests. Like, why are you different and how are you going to beat them out? And then your distribution, I think we've said it before to other founders who are pitching. If someone comes along and has a similar or even a dissimilar solution, but they're offering a something in this area, why are you going to be the one to win? And again, that goes back to who are you trying to sell to? You mentioned that your fundraising is for early clinical validation. And then what? Like, then what happens after that? So you fundraise, you get this money, you have early clinical validation. You also mentioned that the fundraising milestone was to convert early sales to pilots. And that confused me as well. Like, specifically, we need this money in order to do what thing, and then this is the outcome from that very specific thing. So just getting super granular. I mean, if you're asking someone for $2 million, being able to tell them exactly why, what you're going to use it for, and how that's going to benefit them, just getting really crisp on that.
I can go next. Great job on the presentation. I mean, definitely very articulate and same for me. I mean, but we all have heard of sleep apnea, but the way you presented it and the use of the graphics, I think, it was definitely very educational. But where I fell short, and Misty touched on some of this, your business, who's your customer? I kept trying to figure out who in the world you're selling to. Are you selling to the doctors, the hospitals, the patients? And then when you went to the business model slide, that was a very complex slide. You created this kind of a flow. I know there I was trying to figure out, okay, who the customer is, and I still couldn't figure it out. So I think you have the time to be able to really tell us, this is who I'm going after. I'm a B2B, or no, I'm a B2B2C. I'm going to sell it to the doctors. The doctor's going to sell it to their patients. Whatever that model is, these are the things as investors we're looking for in order to really understand the business. The problem that you're solving, the solution are important, but the business side of it is also critical. Really understanding the makeup and the potential of the business. The other thing is talk a little bit more about your regulatory plan. I know you're trying to raise money in order to execute on that, but what does that timeline look like? When will you anticipate having it completed and be able to get into revenue? Is revenue 3 years out, 5 years out, or is it 18 months out? That would be good to understand. And last thing, a little bit about your manufacturing partner. Where are you manufacturing these? What are the licensing requirements about that? What are you thinking in terms of margins for a product like this? So depending on where they're being manufactured, what type of supply chain issues there may be. I know there's a lot of stuff to cover in 5 minutes, but it would be good to touch on it to tell us, hey, I'm using a US-based manufacturer, and our margins we anticipate to be X. That's it. It's one sentence, right? So, but overall, though, I like your pitch. Very educational, nothing else. Very good.
Great. I'll jump in, Payman. You had me chuckling because I said,
I heard.
I said, well, if she can pull all that off in 5 minutes, that is impressive.
But both art and science, right?
That's right. That's right. Megan, really great presentation. I'll be quick. So your presentation was very, very interesting and very informative. If you're imagining you're presenting to investors, what do investors need to know, right? We want to understand what's your go-to-market? What's the business? And you've already heard this, but the way I'd want you to take this away is like, what do investors want to know? They want to know how this is a business. They want to know how I've thought this through as a business that can get to at least 100 million in annual. Understand that I understand the business behind this. So you've hooked us on why this is interesting. We all as investors now want to understand the business behind it. And I think that was really the opportunity for you as you sort of refine the pitch. And then I'll pass it over to you, Eric.
Yeah, wonderful presentation. It's always great when I just know that I'm listening to somebody who knows what the hell they're talking about. I don't really have to worry about too much. You obviously have a very strong command of your domain. The one thing that stuck out to me as I was thinking about the whole time was really around differentiation. And when you showed the differentiation slide, I got more scared, not less, because there were a lot more competitors than I even realized. And what I was leaning in to try to get out of that is like, okay, what makes you unique? What's the one dimension or the one market segment or the one capability that you have that none of them do? And I missed that part. And so then when it finished, I was like, dang it. That was the one thing that I was waiting to hear about. But anyway, yeah, as with all of this, right? This is all feedback. There's no way to cram everything into 5 minutes and hit everything. So, take it all with a grain of salt. But it was a fantastic presentation. And yeah, good job. Okay. Let's keep going. We have, let's see here, MVI Medical. Annie
Hi,
Munoz.
yes, that's me. Thank you so much. I'm going to attempt to share my screen here. Please let me know if this is sharing. Actually, I need to go back here. I said one slide only. I'm just going to share desktop. I think that's easier here. Can you all see the screen here?
Yep.
And it's in slideshow. Please let me know if the slides aren't moving because that happened earlier. And it's fantastic that we're here and we're talking about technology, and thank you for having me here. I know that, 150 years ago, Alexander Graham Bell had only just invented the phone, and now we're able to speak and communicate through Zoom. So this is really fantastic. Speaking of that, 150 years ago, something that hasn't changed in 150 years is gynecological tools. So as you can see here in this picture, I'm holding up a new one, but this is the previous one in my lower left hand. And this tool is 150 years old. And we're still using this tool 360 million times a year in the United States. Now, my name is Annie Munoz, and I'm a physician assistant in OBGYN for the last 20 years, and I have seen firsthand how this tool creates pain, anxiety, and sadly missed diagnosis for cancer. Now, the way the tool is used is that it's placed in the vagina and it retracts the top and the bottom. It's to allow visibility so we can do collections, look for cancer, do procedures, IUDs, endometrial biopsies, 360 million things per year. The problem is that the sidewalls cave in. And when the sidewalls cave in, your only option is to go to a bigger, wider tool, which can create tearing and pain, or to open up the tool as wide as you can, which can create tearing and pain. And often you're not getting the visibility you need. We're still missing 20% of cervical cancers on women that come in, but over 30% of women aren't coming in because of the pain associated with this tool. So we have invented a new tool. It is the ROSA Spec. It offers 360-degree retraction of the vagina. It is made of soft, biocompatible silicone. It is lightweight and has the opportunity to be self-placed, which women deserve that opportunity. And it improves visibility. It is, again, single-use and disposable. There's a future focus on biodegradable. We've done benchtop testing. On the left here, you can see the regular Graves speculum with the collapse of the sidewalls, and then you can see the ROSA Spec in the same benchtop testing box, same amount of pressure, and you can see that cervix, the little tiny donut at the end there. Now, we checked this across all the speculums that are currently in the office, and as you go up in pressure, matching like going up in body mass index on a patient, the regular Peterson is a regular size, the Graves is the biggest, widest, and the Peterson at the bottom is a plastic. And you can see as you go up in weight, all the rest of them are losing visibility, but the ROSA maintains fantastic visibility, which will improve our collections. We are 510K exempt, which has very little regulatory hurdles for us, which is fantastic. Again, we're the only one that offers circumferential retraction, soft materials, and self-placement, and the only one designed by a female clinician. We have a patent that's already been granted, CIP global filings and design filings, again, 510K exempt. 99459 is a code that gives reimbursement now for $22.64. University of Tennessee has signed up to do a clinical study to show we should be standard of care. We have pilot sites already set up across the United States. We have LOIs for purchase. We have manufacturing and distributor partnerships already secured. We were a recent national pitch winner, as well as a recent 100K pitch winner in non-dilutive, and we are currently in the Springboard Women's Health Accelerator group. Our business model is recurring revenue, really. We plan to go out at $14 to $17, and we're going to be targeting the market of the private clinics. And that market, they are already paying that much for their speculums. Our COGS are around $2 packaged, and we've got 85% gross margins. It's a reordering because it's recurrent revenue. So we'll go to pilot sites and we'll expand from there. Again, 360 million speculums per year. It's a large global population. It's half the population, so over 7.3 billion. But again, our target market is that 78 million of private OBGYN clinics. And there are over 29,000 practicing clinicians in those private clinics right now. Here is our trajectory. We plan to launch our alpha. We'll have product in hand in 6 weeks, and then we'll be getting our first revenue. We plan to scale to 150 starting next year, and then be at 1 million revenue, and then be EBITDA positive in 2028 as we begin to scale. We're also building out a light ring. We are going to be using different accessories that will allow us to be surgical, and we will charge more for those as well, and be able to continue with revenue. We have a great team, over 200 years of experience, not just in OBGYN. We have a GYN oncologist and the head of OB at Sharp, Mary Birch, but we also have it in medical device sales, marketing, commercialization. We have a team already strategically planned for that, and the pilot sites. We have Core Medical Venture as a team, and they have already built out medical devices and taken those new companies through acquisition strategically. And University of Tennessee, again, signed on to do IRB study to show that we should be standard of care. We are raising 1.5 on a 10 million valuation cap safe. This current money will go towards manufacturing, scaling, the validation, teasing it out, and helping us with our early commercialization. We know that if you improve visibility and visualization, you can save lives. No woman should have their healthcare compromised by archaic tools. Thank you so much.
I can go first if you guys want. Annie, it sounds like you've pitched this a couple of times. You know, but very clear, great job.
Oh, walking
Oh, look
off
at that.
the
The music.
stage.
Is that for me, Eric? Is that for me?
It is. It is. Keep it moving. No, just kidding.
No, but Annie, all seriousness, great job. Very, very articulate, very clear. I didn't feel like I needed a medical degree to understand what you were talking about. So excellent balance in terms of both the science and the business of what you're doing. One of the things I would recommend, you started the presentation talking about yourself and your background, which is great. I would bring up your team slide and really tell us about the makeup of the team and then go into the rest of the stuff. The besides that, overall, it took a bit to understand who you're actually selling to, but you finally got there and it was pretty clear. And then on your raise, when you show a valuation cap, always include pre or post, especially when you're raising 1.5, which is
Okay.
tough for investors. But besides that, I think you pretty much covered everything. I enjoyed your presentation. The flow was very interesting, the way you had put things together, but I found myself that the answers that I had in my mind and you eventually got to and you answered them. So good job.
Well, thank you so much. I appreciate that feedback.
Thanks. I'll jump in if that's okay. Awesome. Annie, I'm going to go one step back on your intro because you didn't intro yourself. You introed the telephone. And I was like, where is she going? And then it was so smooth the way you're like, speaking of what else hasn't improved in 150, like chef's kiss. I absolutely love that. I do love that you gave us very specific reasons why this needs to exist in several different ways, but in a very relevant manner. The misdiagnosis for cancer is very real, very urgent, very pervasive. The one or two areas that I would love for you to go a little deeper on, you raced through that traction slide. There were so many things, like I would say absolute bangers that you hit on. And if you had to pick, like, where do I double down? For me as an investor, I want you to lean in on those LOIs. You mentioned that you have them. How many? For how much? When do you deliver? What are they waiting on in order to become realized? That would also help your fundraising side. So when you talk about we are going to fundraise for early commercialization, you've already shown us what early commercialization looks like and why you need that money to manufacture and how much you need to manufacture. So it answers questions further down in your pitch. Also, your reimbursement, you were talking in your traction that you've already been approved from there. I would hit that hard. And then the fact that you've already completed your filings, like that is phenomenal that you already have the approval. So if you need to pick and choose, those were the three that really jumped out at me as increasing my trust in your ability to bring this to market faster and easier than someone else who came along that had a similar product. You also mentioned that you are going to launch and scale, and then you said, we plan to. I would much prefer when founders say, this is how we will achieve this thing, and give me the details versus anyone can raise their hand and say, we plan to get to 10 million ARR this year. It's like, that's great. I would also love that for you. That's an amazing journey. How will you do that? And being able to clearly articulate the how is where the top founders stand out from the pack of like, we already know how we're going to do this. Again, it helps me to feel confident when you ask for that money as an investor. Now I'm like, oh, she already knows what her plan is. Hopefully some of it's data back. She's already told me about these LOIs. So now I have more confidence in the fact that she's asking for this amount of money, and I know exactly where it's going to, why, how she's going to use it, and then selfishly how that'll benefit me. But nice job. I feel like I can call myself Dr. Kane now. I feel like you just PhD. Love it.
My feedback is minimal. Annie, you crushed it. I have actually heard her pitch before. My feedback's minimal. You did a fantastic job. I'd say I even think that, yeah, my feedback is very minimal. The main thing I would say is I really do think that in this pitch, you undersell the product and what's unique about the product. I mean, you kind of breeze through that. And I would try to drive it home a bit more clearly and loudly. And how one does that, I can give that some more thought. But I think that was probably my main piece of feedback. You have very clearly prepared for the pitch. You hit both the science and you hit the business side. You were very clear. The accomplishments you've already hit were so impressive. So really, really well done, Annie.
Thank you so much. Appreciate it.
Yeah, and I'll just say quickly, I mean, similar to our last speaker, I mean, obviously, you are in command of this domain. I mean, it came really clear that you are an expert in your field. The only thing that stuck with me from the very beginning was why hasn't this been fixed over the last 150 years? And the answer that always comes to mind for me, especially in healthcare, is because it's such a damn hard industry to break into, and it's so hard to get products to market in this space. And so anytime I'm looking at a healthcare life science investment, I'm always looking at it's really about the approval process and the go to market. There's so much innovation happening in this space, so many people trying to break in, and so a little bit more emphasis on, this is why we're going to get the fast track, or this is why it's, we've already got these relationships with these clinics or with these hospitals, or like maybe we don't have to go through the same level that other folks do because we're going in the I don't know, some other route, private practice, whatever it may be. But yeah, again, just the difficulty of getting these kinds of products to market is the thing that's always sticking with me. But overall, fantastic presentation.
Thank you. I appreciate it. Thank you all for the feedback.
Right.
It's very helpful.
Yeah. Okay, let's move on. We got just a couple left here. We have Tina with Avira Health. Hey again, Tina, how are you?
Hi, everyone. Can you see my screen?
Yep.
Okay.
All right, ready when you are.
Yes. Hi, everyone. My name is Tina John. I'm a biomedical engineer, mother of 3 girls, and founder and CEO of Avira Health, which is launching Vera. Each year, 1.2 million mothers drop out of breastfeeding because of pain, latch, or supply. I'd like to introduce you to baby Vera. Baby Vera is nursing at the breast, and she's having difficulty nursing. Because she can't latch appropriately, she's not effectively removing milk from the breast, and each day my supply is dipping day after day. And also, because it's an ineffective latch, I'm experiencing pain each time she comes back to the breast. 1.2 million mothers drop out of breastfeeding within the first 2 to 4 weeks after having their infant for these reasons, or they move to exclusive pumping, the top left picture. This is where they are feeding the infant 8 to 12 times a day from pumped milk, which is pumped 8 to 12 times a day. This increases about 5 to 6 hours of work in a typical newborn day. After speaking to over 150 mothers and families across the US, we realized that the breast pumping market was never invented to feed the infant that was right in front of you. That is why we developed Vera, the smart feeding pump. This is the first device in the world that allows you to pump and feed at the same exact time. The back container will capture the milk as the mother is pumping, and if the mom chooses to use the front nipple, they'll be able to see how much the baby is drinking while the baby drinks from the milk at the same exact time. This not only reduces up to 4 hours a day for exclusive pumping mothers, but provides a confidence for moms on how much the baby is drinking live as they view that amount on their mobile device. Our device works so that we capture the milk in the back container, and it is pushed to the front container as the baby is suckling and drawing the milk and creating this responsive device. We have 1 patent granted around our technology and 6 additional patents open and filed across the globe. The breast pump market is a $2.9 billion market right now. I say that because we will open a new category of smart feeding pumps, which will both encompass and enlarge this market by 5% in the next 5 years. Now, our competitors are high-end wearable breast pumps that have strong suction and sit discreetly within the bra. While there are devices across, no other competitive devices are able to also feed the infant, but of course our device can be used to just pump at solely and be a direct competitor to all those others. 2 years after we launch this market brand, this initial pump, we will be marketing our second low-cost pump, which will retail for $269 and also be able to encompass the next 80% of the market. We'll get onto the market in 3 distinct ways. First, direct to consumer via our website and websites like Amazon. Second, by health insurance reimbursement, where half of our $560 unit of pumps will be covered. And lastly, by retail, as we start to build presence in stores like Target and Walmart, which currently have wearable pumps on the market. We have an amazing team behind this incredible invention with over 50 patents between us, over 20 510(k) clearances, and dozens of both consumer and medical devices in our portfolio. As we speak, our team is actually doing our final testing before we hit the FDA. Our device at scale at 10,000 units or larger will have 65% gross margins, and most of our revenue will be between the two 510(k) cleared devices, both the device I showed you and the low-cost device that's coming out. We raised a $1 million pre-seed round and are currently in a $3.5 million seed round, which will get us all the way through FDA clearance with our first 1,000 patients. We are currently $2.5 million into that round with $1 million available on a $20 million pre-money cap safe. We are excited about not only what we've been building over these years, but also the fact that we have sensor-enabled technology, which gives us a lot of different a multitude of different data, allowing us to apply AI and exceptionally have an understanding of about the clinical understanding of the postpartum weeks in the home. Thank you.
Misty, you want to go first?
Yeah, I'll kick us off. Tina, I have heard you pitch. We have even been on panels together. So I'm going to call out the elephant in the room. This one was very disjointed for me. So I understand what you're building, and that's because I know you and I know what you're building, and I've seen you at other pitch competitions, and as well as giving your founder story. I know that we're not allowed to ask questions, and this isn't a back and forth, but I would like to cede some of my time, 30 seconds, maybe if you just want to address, if this is okay, Eric, you can also veto this. But is everything okay first, and what's going on? Because it felt like the pitch was just more disjointed than I've heard in the past. And then after that, I'll let other people give feedback.
Nothing of particular mention. It's also surprising to me. I was like, oh, I don't have my game on today. But yes, I know we've talked many times before, so I appreciate the comment.
Okay. Thank you so much. I will let others chime in on the pitch itself.
I appreciate the compassion, Misty.
Yeah.
No worries.
I'll jump in. Well, one thing, don't do the scrolling with the PDF or whatever you're doing. Just use something that you can go transition, and that way the slides come across a lot cleaner. But I felt the same. It's like it was a little bit. It seemed like you were kind of thinking off the top of your head as you were pitching. So the story, how it all came together, what was a little off for me. But overall, I mean, the things that I was really wondering about, like, what's your unit economics? What, the differentiation that you're showing, it's like, how is there, so I wasn't convinced that there's a market out there of millions and millions of moms that wanted to do the pumping and the feeding at the same time. And I may be wrong. It's just the way it was presented. That wasn't like, that was the big differentiator. I had actually, personally, I mean, I do have, they're not kids anymore, but, so I have some experience as a father around this, but I never thought this was something that was needed. So it was kind of interesting seeing it from your perspective, but it made me wonder, how real is this market? How many moms are out there actually looking for a solution like this? So that part was a little not complete for me in terms of really understanding your business and why you're doing what you're doing. Besides that, the unit economics and also the financial model that you showed, you barely touched on it as to how that's happening, where the growth is coming from, and things like that. But yeah, that's kind of solid. It's interesting with Misty's feedback that there's a version of this that's much more crisper from what I heard. Lakeisha?
Yeah, I got booted off for a little bit, but high level, this is a space where my firm invests. So love hearing what you're building. Obviously, it's very, very much needed. I think you heard really great feedback. The main thing I would encourage you to sort of walk away with is understanding that there are a lot of there are a lot of solutions similar to what you're describing in the space, and it has become a space that's a bit saturated, and there are at least two companies that have pretty successfully gotten to their Series A. So what would be really, really compelling is for you to say, hey, like, I have a deep understanding of what is happening in the space. I have a deep understanding of what's happening in the market, and where there's a what is absolutely missing in the current offerings is X. And not only do I have a deep understanding of what's missing, I've built the thing that's missing. And this is why these other companies who are doing this, don't stand a chance now that I'm doing this. I think that, and this is for someone who sees a lot of startups in this space. I think that would be compelling if you're, from an investor standpoint. And then the other piece that I would say, it's similar to some of the feedback that we shared before. The investor lens wants to understand, how is this venture scalable? And I want you, as long as you keep that in the back of your head, I want to make sure that by the time investors walk away, they understand how I intend to scale this business. Then you're good to go. But love what you're building. I think it's incredibly important.
Thank you.
Yeah, I don't have too much to add. It was I've seen the presentation before, so I did get the gist of it, and I'm doing my best to at least score based on the presentation that I heard, not previous information that I've had. But the one piece that stuck out to me was around differentiation, and like the images of the other products that you showed looked really great to me, and so I wasn't quite sure about exactly where the differentiation was. And I think, kind of to Paymon's point too, like the value of the differentiator that you have, that it's sort of a pass-through device. I got the part about allowing you to kind of monitor and track, and especially people that have difficulty. But I wasn't quite sure that I didn't get that all of those other high-end ones that you mentioned didn't have that capability. So that was just, one thing that I was a little bit stuck with. But otherwise, again, very, very strong business model, strong traction, and all that.
Thank you.
All right. So thank you so much, Tina. All right. We have our final pitch of the evening.
All right. Sound check.
BioMetal
Y'all can
Health.
see me.
Yep.
Y'all can hear me. All right. Cool. And hold on while I make sure I can actually share this thing. Just one moment, please. And can you see it now?
Yep. All right. You are.
Okay. Hold on. I don't see the timer now. I've lost the timer. Hold on. Just make sure.
Okay, well, I haven't started yet, but can you see me? I'm over here.
I can see you. Yes. Okay.
So I'm going to start the timer. You'll see it just in the little corner there.
All right. Okay. Hi, I'm Joe Yen, CEO of BioMetal Health. I've invented and commercialized 7 military-grade innovations from material science to 3D printing, but I'm most excited about BioMetal Health, my third startup, delivering our patented metal coating that dissolves for faster healing and less pain. 30 million Americans suffer from chronic back pain, with spinal implants failing at a high rate. That's an unsustainable $12 billion reoperation burden on the American healthcare system. That's why my co-founders spent 14 years and $5.5 million analyzing zinc metal. The science is not new. We know that zinc, essential for human life, can accelerate healing and fight infection using the body's natural ability to grow and protect. But it's BioMetal's patent that has engineered a unique balance of strength and safety over time, becoming the first coating that will accelerate bone growth while fighting inflammation and infection at the same time. No other material does all that with minimal complications. Mag alloys looked promising until it created painful hydrogen gas pockets. PLA was cheap, but increased inflammation. Titanium dioxide tried to fix that inflammation, but had no effect on infection. Only our BioMetal coating can balance performance efficacy across more use cases with all of these benefits. And we validated this with the toughest, most skeptical clinicians we could find. They scoured through our preclinical large animal data for safety and performance. And now we have raving fans from private practice to university hospitals to military trauma surgeons. They called us a game changer. So I built an elite team with deep commercialization experience. The company is 7 years old because I did all that pre-work in advance. And this team has a successful track record of 39 FDA clearances. I've also known everyone here for years. We're all aligned on our mission to improve people's lives with decent personal runways so we can make this happen. In just 7 months, we've driven traction along the fastest path to revenues, fitting Dr. Jack's engineering to orthopedic spine benefits, enlisting 10 spine surgeons to validate our clinical benefits, ensuring Medicare and insurance payment, articulating our lowest risk FDA strategy, making it into the MedTech Accelerator and Techstars USC Top 10. They only accepted 8, unfortunately. Now in due diligence with 3 VCs. In 2026, for the first time in US history, Medicare and insurance have agreed to pay for dissolvable metal implants at full pass-through reimbursement because they agree with the huge potential to reduce the reop burden. Only BioMetal has engineered the degradation rate control to tackle the full $220 billion market. But we know the road to revenues must go through the FDA. So we've taken a proven fast-track strategy, land the coding through a substantial equivalence. Once approved, expand across all implant partners, spine, joints, dental, even cardiovascular stents, and then finally protect with patents and trade secrets. Commissioner Dr. Marty Makary has focused on lower cost and accelerated approvals. A thin coating of 510K for a 510K substantial equivalence that lowers reop costs backed by 20 years of peer-reviewed research is a narrative that's aligned to faster recent approvals. In 12 months, we expect to be the only patented absorbable zinc coating FDA approved to sell in the US of A. We chose spinal reoperations as our beachhead for its massive problem and great unit economics. $14 billion market, 70% gross margin, $3,000 per unit. And we've addressed every part of this ecosystem to become the standard of care from clinicians, payers, hospitals, and implant partners. And that will lead to our ramp to 168 million by 2032, 4% spinal penetration, 0.5% of eligible implant penetration. That's small, and this is an active market for liquidity events. BioMetal Health is a first-to-market land and expand startup, protected by the patent. Speed is critical. 3 million by May, accelerates FDA submit by October, and launches sales by next March. We have 3 distributors with selling contracts to 4,000 surgery centers, covering 20% of the US market. We're speaking to 8 implant partners. Just 1 FDA clearance unlocks this $220 billion market. My team is proven with 39 FDA successes, and they've crafted a compelling narrative for this administration's remit. And we're in due diligence with 3 VCs. A $3 million investment will drive a 25x in 3 years. I invite you to join our mission and help 30 million Americans. Thank you.
All right on time. Thank you. Who would like to go first?
I'll start us off, and then
we got to get like a real band for like the semifinal. You know?
I love it. Only if it's mariachi. I loved your intro. I feel like number one, bringing the energy, the way that you're giving your presentation was great. The conciseness of how you explained who you are, what you did. I'm like, high confidence. This is awesome. We're on the road. The areas where I would love for you to dig in. Number one, I know Payman's going to mention it, but I'm going to beat him to it. There's a lot going on these slides. You have a lot of words. And so when you're doing a presentation style, I would love to be able to focus on what it is that you're saying. But I found myself in the midst of a War and Peace type of deck where there's so many words. The other thing is I wasn't clear on who the buyer is and why do they need this right now. Now, this is incredible. Again, everyone is building something incredible technology. I love that you have some defensibility around it, but I'm not sure why they need it right now. And even though you had great testimonials, sometimes people are just nice. Customers lie. They don't do it on purpose, but they do. You're a very affable guy. I'm sure that when people meet you, they're like, this is great, but will they buy it from you? And that's where the rubber meets the road of actual traction. So instead of the niceties or the fantasy XLS, we plan to, similar to what we were saying earlier, I would love to see the actualities. Do you have any LOIs? You mentioned that you had 10 advocates, which again felt kind of loopholey of like, what is an advocate and what does that mean? And for me as an investor, you said that once this is approved, when does it get approved? What's the challenge or what's blocking you? Any doubts that you may have, you actually have, and that I may have as an investor? I would love for you to just get it out in the open and then tell us about it. You also said that you're going to be the only provider with this coding. And when I hear words like that, right, and you're shaking your head, and I want to believe.
We are.
I do.
Look
I
it up.
want to. It feels good to believe you, but I'm gonna need a little bit more. I want you to explain to me how and why that's possible, simply because for every Uber, there's a Lyft, for every Airbnb, there's a Vrbo. Like, how are you going to have a chokehold on this, especially in our very diverse and entrepreneurial friendly US of A? There is a very clear problem and benefit. Is it urgent and pervasive? Do we need it right now? And if so, prove that with your pitch. And then lastly, you said you got $5 million in non-dilutive grants, but I never heard what that was used for. And now you're coming back. We need an additional $3 million. Like, what's going on there? Where's all this money going? And how are you using it to make investors more money? Again, being selfish there as an investor.
Thank you, Misty.
Absolutely.
Great feedback. Appreciate that.
Yeah.
Now, I'll jump in since Misty mentioned me. So that was going to be my first thing. And she knows. I mean, the thing for me was actually some of your slides, as you were speaking, I started reading what you had on there. And then before I could get through not even 20% of it, you're already on the next slide. So then I kind of lost it there. But so you're extremely articulate in what you're talking, and then the passion comes right through. So I think some of the stuff you have on the slide, you can really trim back and really hone in on. And think about, these slides. I mean, I guess feedback for everybody. These slides aren't for you guys. You got to put into perspective your audience. What are they thinking about? What questions do they want to answer in their head? Let me hone in on those things. And it makes it go much, much easier. One of my concerns throughout this whole thing was when I, saw the beginning is FDA. What's it going to take to get this thing through FDA? And you increased my confidence level when you talked about the team and the fact that they've been through this. So that was great. But still, you didn't really clearly tell us, here's the plan. This is what we're doing. This is when we're doing, I don't know, animal trials, human trials. This is what the plan is. This is how long it takes. See, these type of companies are super risky to investors because they're all worried about FDA. What if the answer comes back? Nope, sorry. We just invested all this money. This isn't going to go anywhere, right? So the more confidence you build there, it helps your cause. And the same thing regarding the grant versus. So now all of a sudden you're up to $8 million in funding. What's going on? What happened with the 5 million? So tell us a little bit more about that. But overall, good job. I mean, very articulate. It was very easy listening to you, and I could follow along. But if I tried to read your slides, then the disconnect will show up in places. So, but
thank you, Pijan.
Yep.
Yeah, they were heavy.
Yeah, I think, Jerry, half of the job by the time, if you're the last act, is to engage investors, and you did a really fantastic job of that. Your pitch was very clear. It's very clear what you're offering. I think what I'd get on to the last person, I think the main thing I would take away is what I think we've been saying a lot today, which is really think about your audience, right? And so as investors, we really want to understand. Well, actually, hold on. I actually do want to share with you something that I thought that was really good before I go here, which was you did say, hey, here's my path to 178 million. I would have liked for you to delve more deeply, but I think in doing that, you hit a question that I had in the back of my mind, even though it took you a little bit to get there. So I do want to say that was great. The main thing, though, I would share with you is your delivery is great. I want you to spend a little bit more talking to us about the business, particularly what you've heard a lot today, which is also, if it's FDA, right, talk to me about how you submit to FDA in October and that you're able to go to market in Q1 of 27, right? So that might be possible. I'm sure given for folks who are investing in this space, we want to hear how you intend to do it. That's my main feedback. I thought you did a really fantastic job. And of course, I don't need to to beat a dead horse, I really do think when it comes to presenting, visuals are great and clean, clear messages per slide, right? When there is a lot of text, I wasn't sure I'm like, where should I go? Where should I focus? And so you really do want to take your audience into the main point of each of your slides. But I do not want that to distract from the great presentation that you delivered today.
Thank you very much. Good feedback. Thank you.
Okay, wonderful. I'm gonna pass. I think everybody gave some really good feedback on this. Yeah, like I said, I think it was a very well delivered presentation. I don't have any, constructive feedback that anybody else didn't already cover. So let's go ahead and move on. So those are all of our pitches for tonight. First off, thank you and congratulations for everybody for being here tonight. I appreciate you taking time out of your evening. Whether or not you make it on to the next round, make it on to the final, this is also just really good practice and training for all of you for really getting in front of investors. And that's why we're really emphasizing the feedback side of this. Okay, so we want to take about 5 minutes to deliberate. And then we will come back and pick the top 4 that are going to move on. Faisal, can you set up a breakout room for us?
Yeah, let me set up.
Everybody, hang tight. We'll be back in a few minutes. Y'all ready? Okay.
Yeah, you need music.
Where's that music?
Drum roll.
Forget it. Okay. All right. So first up, we have MVI Health. Annie Munoz, you'll be moving on to the next round. Congratulations. Yay.
Thank you. Very excited. Thank you so much.
Awesome. All right. Next up, we have MetaNeural. Claudio, you're moving on to the next round. Congratulations.
Thank you.
And there was much rejoicing. All right. Next up, we have BioMetal Health. Jerry Yen, you'll be moving on to the next round. Congratulations.
Congrats.
And last but not least, drum roll, we have Baritone Health, Megan Pitcher. Congratulations. You're moving on to the next round.
Thank you.
Congrats.
Awesome. Thank you and congratulations to everyone who made it.
Good job, everyone.
Again, thank you and congratulations. Great job to everyone else.
Congratulations.
Congrats,
Congratulations, yeah. We'll see you on 16th.
Yeah, we hope to see all of you, at the TechCon event, and be part of this community. Feel free to reach out, stay in touch, be in touch with each other, and let's all support each other to be successful in our businesses. All right. Yeah. Faisal, any parting words?
Yeah, I think thank you so much for all the judges and the selection committee. You guys really spent a lot of time, a lot of effort, and the diligence that you did. I think, and all the founders, thank you for presenting and being part of the process. And hopefully, wishing you all the finalists that have moved to the next round all the best. And see you on 16th and see who goes to the finals on the 7 companies here. Exciting.
All right. Thank you all so much for your time. Enjoy the rest of your evening. Take care.
Thank you.
Thank you so much.
Thank you so much.
Bye.
Take care, everyone.
Bye-bye.
Bye.